Hello, everyone. Welcome to this webinar. Good afternoon to those of you joining us from Europe, and good morning to those of you joining us from North and South America, and good evening and good day to everyone in between. My name is Frida Lampinen, and I'm a junior research fellow at the Institute for Security and Development Policy, or ISDP. And it's a great pleasure and honor for me to participate as a moderator alongside such distinguished panelists, whom I will introduce shortly. I'm very glad that you're all dedicating your time and effort to participating in this discussion today. And of course, a big thank you to all of our online audiences. We are very happy that you are participating and showing your interest in this very important issue. So the webinar today is about the post-pandemic policy considerations in North Korea. And in January 2020, the Democratic People's Republic of Korea, the DPRK or North Korea, became the first country in the world to shut its borders in response to the COVID-19 outbreak. Now, after more than 3 years of strict pandemic responses, North Korea is showing signs of reopening as its interactions with the world are increasing. This past Friday, South Korea's Unification Ministry confirmed that China has repatriated North Korean citizens from China's northeastern regions, something that Beijing was likely unable to do while the closed border policy was in effect. North Korean athletes have recently been participating in international events such as the Asian Games, and Pyongyang has received Chinese and Russian diplomats. And of course, the biggest headline of them all recently, North Korean leader Kim Jong-un recently made his first trip abroad since 2019 to visit Russia and President Putin. Still, the pandemic era is likely to have a lasting impact. Human Rights Watch has argued that North Korean COVID restrictions have been excessively strict and that Pyongyang has leveraged the pandemic as a pretext to fortify border security. The loss of cross-border mobility along the DPRK-China border has had far-reaching effects on domestic livelihoods and public health by exacerbating existing food insecurity. Additionally, given insufficient information about the public vaccination campaign against COVID-19 in the country, it's not known whether they have achieved herd immunity. At the same time, the Ukraine war has spurred a shift in the dynamic between Russia and North Korea, and as the pandemic restrictions are lifted, in-person meetings may become more common and consolidate this momentum. Recent developments, such as the rumored arms deal, indicate that North Korea and Russia will seek to deepen bilateral cooperation going forward in a way that was not possible for the past 4 years. Now, to explore cross-cutting issues in post-pandemic North Korea, the ISDP Korea Project is honored to organize this webinar, and our discussion today will depart from what is known about the current situation in North Korea and cover probable future developments related to the implications of the regime's recent initiatives. And we hope to explore the nexus between security and development issues. We will shortly be in for a treat with 3 presentations by 3 excellent speakers who I will now present in turn. First, we have Fei Su, a researcher at the China and Asia Security Program at Stockholm International Peace Research Institute, SIPRI. Ms. Su's fields of expertise include security issues in North Korea and the broader East Asia region, including China's foreign and security policy, cyber, and maritime security. She holds a master's in public administration from the Graduate School of Public Administration at Seoul National University. Coming up, we have Dr. Ki Park, the Director of Korea Health Policy Project and the Director of Policy and Advocacy at the Program in Global Surgery and Social Change at Harvard Medical School. Dr. Park has much experience with public health in the DPRK, having served as the director of the North Korea program at the Korean American Medical Health Association between 2011 and 2021. Dr. Park is also a consultant for the World Health Organization and serves on the WHO Expert Advisory Panel on Surgical Care and Anesthesia. Our final speaker is Margareta Wahlström, a former president of the Swedish Red Cross and former special representative of the UN Secretary General for Disaster Risk Reduction. She has many years of experience working at the United Nations, the International Federation of Red Cross and Red Crescent Societies, as well as in private sector disaster relief operations. Ms. Wahlström has accumulated a wide range of experience spanning from sustainable development to emergency management. Following the three presentations, we will have a panel discussion led by Margareta Wahlström that will touch on the implications of the fortified China and North Korea border on regional trade and the domestic humanitarian situation, looking at also the risks of an epidemic resurgence, how intensified engagement with Russia may affect the UNSC sanctions regime, and what possible roles NGOs and IGOs can play in diplomatic and humanitarian efforts with North Korea. Now I will stop speaking because we're all here to listen to our panelists. I'm pleased to hand over the floor to our first presenter, Fei Su.
Can you hear me? All right, thank you, Felida, for the great opening introduction here. And I'm now honored to share my views to this important topic. So recently we have witnessed significant signs of North Korea reopening its borders, such as Kim's visit to Russia and a substantial delegation of nearly 200 North Korean athletes participating in the Asian Games held in Hangzhou. These developments raise critical questions about their implications for the international community. Could this signal the start of broader engagement? What are the factors that could either facilitate or hinder such engagement? So I really appreciate ISDP setting up this event, and it's very timely. You've given us a list of questions that are thought-provoking, and I would like to begin by reflecting on two recent and important developments: the meeting between Putin and Kim, and the trilateral relations between China, Russia, and the DPRK, but more from a Chinese perspective and a security perspective. What does this development tell us regarding the need and willingness of North Korea to engage with the broader international community? So the 6-day trip Kim made to Russia has made quite a headline in the news, starting with a welcome by Putin at the space launch facility. This location is very interesting, especially since it's just a couple of weeks before Kim's visit. North Korea has failed its second attempt to place a reconnaissance satellite in orbit. And there are significant concerns triggered by these meetings regarding military cooperation between the two sides, with North Korea providing ammunition to Russia in return for food, gas and oil, and perhaps also the transfer of military technologies from Russia related to satellites, missiles, aircraft, and submarines. And just last Friday, the White House stated that North Korea shipped more than 1,000 containers of military equipment by sea from Najin in North Korea to Dunay in Russia, and then delivered by train to southwest of Russia between September 7th and October 1st. Now, this distance and the ways they transport, the transportation of this military equipment is very important, because there are doubts, wonder how significant of North Korea's contribution to support Russia's war in Ukraine due to this limited transportation capacity. And it does look like it takes a long time. But despite of these logistic issues, North Korea reportedly has recent starts accelerating the production of ammunition and exporting the existing stockpile. Kim also received gifts, including 5 explosive drones, a reconnaissance drone, and a bulletproof vest during his trip. The timing of this drone gift is very interesting, as South Korea launched a drone operation command 2 weeks before Kim's visit. And more importantly, these gifts are prohibited by UN sanctions. So it's quite a high-profile violation of sanction. This triggered concerns over whether there will be continued open violation of sanction regimes by Russia, especially after Russia's foreign minister made a worrisome statement in last month saying, and I quote here, "Russia did not declare sanctions against North Korea. The sanctions was declared by the Security Council, says you should contact the Security Council and we will develop an equal fair cooperation with the DPRK." But it remains to be seen how far this potential military cooperation between the two sides might go. It seems like a win-win situation for them to deepen bilateral relations under the current circumstances. While there are no official agreements or MOUs was signed during the trip, but the meeting itself is symbolic enough for Russia to use North Korea as a card to warn against South Korea's support for Ukraine. And for North Korea, it perhaps secures continued support from Russia to block new UN sanctions, a possibility for military support from Russia, and also a high-profile diplomatic exchange marking the beginning of the reopening of its border. And it is clear that North Korea regards Russia as its primary focus now. And perhaps this deepening relationship is also trying to gain a certain level of autonomy from China. North Korea could certainly benefit in the short term, either by exchanging for food and oil or by receiving military support from Russia. However, in the long run, this might not be that sustainable. And as the primary trading partner of North Korea, China's leverage remains. China has been quite consistent in its position on denuclearization and the proliferation concerns regarding transfer of missile technologies. So in this context, China is most likely not in line with Russia's approach by providing technological support to North Korea for advancing its nuclear and missile program. And we can see also in the space satellite launches that historically China has been more hawkish or more against in this kind of activities. In the case of the 2016 launch of the Guangming 4 and Earth observation satellites, China's official stance has mentioned that although North Korea has the right for peacefully using the space, it is restricted under the UN sanctions. Therefore, China hopes that North Korea could restrict its activities in launching more satellite tests. But we do see there's a changing of discourse in Chinese stance, especially after this August satellite launch by North Korea. China has, together with Russia, blocked a unified UN security response. Now, this could be due to the current geopolitical changes and tense relations between China and the US, and not necessarily means that China is supporting in technology transfer to North Korea. Both Chinese and South Korean ships searched for debris from the failed launch, and South Korea's initial assessment indicated that the design of the latest satellite of North Korea was still underdeveloped to fulfill any meaningful military function, even it had been launched successfully. And when it comes to the trilateral relations, the rhetoric regarding the block lines between China, Russia, and North Korea on one hand, versus the US, Japan, and South Korea on the other hand, has intensified over the past years. And it looks like North Korea is embracing this new Cold War structure and pledged to develop strategic and tactical cooperation with both China and Russia. This type of cooperation was mentioned also during Xi Kim meeting back in 2018. And again, it was emphasized by the North Korean defense minister in last August by sending a message stressing the willingness to wage strategic and tactical coordinated cooperations with Chinese PLA. And also during Kim's meeting with Putin last month, Kim emphasized the importance for further strengthening strategic and tactical cooperation between the two countries to a new higher level. However, China has been cautious being dragged into this triangular relationship. Chinese officials have stressed at various locations against bloc confrontation and the Cold War mentality. And experts from Chinese government-affiliated think tanks have argued that this concept of bloc confrontation is promoted by the US, which aims to create justifications for bolstering the US-Japan-South Korea partnership, especially for their military cooperation. So China has so far tried to distance itself from being labeled as part of China-Russia DPRK alliance. All this said, recent development means we can infer North Korea's need and willingness for engagement, maybe from three parts. The first is military technologies to improve its missile, nuclear, and satellite programs. Second is trade with other countries to enhance its economy. And perhaps more importantly, to provide foreign currency for importing food. And the third is to break the isolation bubble after the 3 years pandemic by resuming diplomatic exchanges with selected countries such as China and Russia, and perhaps also with other countries that considered neutral. But this is only one side of the equation. We also need to look at another side of it. So to think about what the broader international community is able and willing to offer. And among the factors affecting the international community's engagement, the most obvious and major one is the international sanction regime. Both the unilateral sanctions, such as those imposed by the US, and the measures adopted by the UN Security Council. There have been 9 major resolutions since North Korea's nuclear and missile test in 2006, and North Koreans probably facing the strongest and the most comprehensive set of sanctions currently in effect compared to other countries. And given that the international community is fully committed to implement the sanctions, there are severe limits on the channels for engagement with North Korea. For example, on trade, certain North Korean exports are completely banned under UN sanctions. For example, agriculture products, coal, iron, textiles, seafood, labor, and etc. And of course, there are cases of sanction violations, and the drone gift Kim received during his trip is just another recent high-profile example of this, which the drone are on the list of prohibited use technologies under the UN sanction. And there are also black markets between China and North Korea, for instance, trading in seafood products. Another major factor is the changing external security environment, the Ukraine war, the tense geopolitical competition. So many things have changed during North Korea's lockdown. And this coupled with internal developments in North Korea, such as the announcement of the law on DPRK's policy on nuclear forces last September, and efforts towards the nuclearization of the Navy, which is evidenced by the recent rollout of its tactical nuclear attack submarine. And Kim also made a statement last September during, which is very clearly stated, and I quote here, "We have drawn the line of no retreat regarding our nuclear weapons, so that there will no longer be any bargaining over them." So that indicates it will be challenging to elicit any response from North Korea if engagement is attempted with a denuclearization aim. But there is still an urgent need to re-establish diplomatic exchanges and to reduce the risk of misinterpretation of recent developments regionally and globally. So this is also perhaps in the interest of North Korea for exchanges through official channel. And in addition, non-official channel of dialogue and communication, and perhaps people-to-people exchanges between scholars could also be considered as a possible step for exchanges when there's opportunity. I will stop here and look forward to my other colleagues' presentation and our exchanges today. Thank you.
Thank you so much for that excellent presentation. We will move swiftly on to Dr. Ki-B Park.
Thank you, Frida. And just want to say thank you to Ricardo and Anna as well for their help. I listened to Faye's presentation with much interest. It ties in very well to what we're going to talk about now, which is post-pandemic. I'm a medical doctor. I work in the health space primarily, so my comments will be restricted primarily towards health cooperation with North Korea, but I think it has implications with overall assistance, humanitarian otherwise. So I think it's best to, before we talk about post-pandemic, maybe with some broad strokes, we talk a little bit about pre-pandemic. So prior to the pandemic, North Korea was a reluctant partner, is how I would describe it, to international assistance to health. Why is that? Well, number one, the dollar amount's too small. It's, I think, $35 million a year. That's just a little over $1 per person per year. And in order to support that kind of relatively minuscule amount of assistance, the apparatus they have to maintain the in-country activities for these organizations is massive. You know, every organization requires the whole team of people, and some of you know that. And so I think they were reluctant at best, but they still had interest in a number of programs. For instance, the immunization program through Gavi, Global Vaccine Alliance, that's been going on for years and still goes on as far as I know. Global Fund, they provide funding for tuberculosis and malaria. And that was going on for about 8 or 9 years until it was shut off through political pressure, most likely. But the grant has been restored. I'm not sure the programming has resumed, but the idea is that that program will continue. Of course, UNICEF does a lot of programming inside countries. Specifically, I think the most significant one is the malnutrition for children. UNFPA does emergency reproductive kits during obstetric kits during emergencies during the childbirth. And then there's other organizations that are not international organizations, like Eugene Bell Foundation, that were doing the multi-drug resistant TB programming. So I think there were these programs are ongoing, but almost all of them stopped during the pandemic. Now, prior to the pandemic, there are a number of things that complicated the delivery of assistance. I think Faye talked about it: the sanctions, the exemptions process for humanitarian goods to go in, activities. It's incredibly administratively heavy and restrictive. Global Fund, as I mentioned, turned off funding for about 1.5 years, and that was unexpected. And there was another example of South Korea, North Korea health cooperation. When Moon Jae-in administration was in power, they agreed to provide Tamiflu. This is pre-pandemic. And they actually had truckloads of Tamiflu and went to the DMZ, and they were turned around by the UN command at the DMZ. And then by the time the trucks were allowed to go back in several days later, the North Koreans lost interest. You know, so say, forget it. No, we're not gonna. It's not worth it. So you can see the layers of complication that the country was experiencing, and then humanitarian organizations, whether it's countries or organizations, and working with North Korea. Now, what happened during the pandemic was, as you all know, they went into an isolation, and all the humanitarian workers left the country. We don't know what happened. We still don't know what's going on at the moment. And then most of the programming also stopped because of the delay in goods for going in. There were thousands of containers being sort of backed up in the Chinese border. But those are starting to flow again now. But even now, the humanitarian aid workers have not returned. But also, what's important is the North Koreans decline assistance, and even direct assistance, things like vaccines, even COVAX, which they had signed up for. Once it was offered to them, they declined multiple times. There was also bilateral offers of vaccines, at least from the US side, and that was declined. Now we'll get to the main topic, which is post-pandemic, right? You know, what are our prospects for re-engaging, at least in the health space? Let me just try to draw a picture of, I think, where North Korea is post-pandemic. We've been analyzing the Chinese import data, which is reported every year. It's understood that it's probably an underreporting of what's imported, but what's also important is that it doesn't include UN agencies procurement. So these are presumably purchases by the North Koreans from the Chinese companies. We've seen record amounts of health-related goods being imported. For example, Medicines, I think they went from $4 to $5 million worth of imports prior in 2016, 2017 to now in 2022, $45 million worth of pharmaceuticals. They're importing things like insulin, and they've increased it by almost tenfold. And according to our calculations, the amount of insulin that they're importing is enough to cover about 75% of the country's needs for their diabetic population. So there are people who say, oh, they're only importing drugs just for the elites. It doesn't compute in my mind, because insulin is perishable. It has to be stored in refrigerators. So if they're importing that amount, it clearly is designed to cover a majority of the population, but certainly not all of them. So post-pandemic, they're increasing imports. The other political considerations that there was a WHO project to strengthen pediatric surgical care in DPRK. It was stalled because of the pandemic, but then just I think within the last year or so, WHO said they received a letter from the North Koreans canceling the project, saying that if the funding was coming from the South Koreans, which in fact it was. So this is a shift from what North Korea has done in the past, because they have had projects funded primarily from the South Koreans, and they've accepted it. But this time they seem to not be willing to do that anymore. And that goes along with, I think, what they're trying to do is avoiding politicized money. I think they've had it. They just don't want to deal with it. So saying we'd just rather not do it. And they've also indicated in their national newspapers, if we're going to engage with international community, they should be done in a spirit of dignity, partnership, rather than a donor-recipient, charity, desperate recipient type of model. I think that those days are now sort of behind us. And it's not clear, borders are open, when and which organizations will be returning, and if at all. They may, we don't know. Some of those organizations that have been in country for years may not be able to return for whatever reason. Now, this brings us to a sort of, forward-looking. If we are all interested, and it seems like for North Korea, health has never been a higher priority than it is today, then if we're going to re-engage, what are the rules, right? So we do have rules for humanitarian assistance. Margareta, I'm sure the General Assembly at the UN passed these principles, humanity based on need and need only, impartiality. We don't discriminate who receives the goods. As long as they need it, they should get it. And more importantly is neutrality, right? The aid, we should not, it should never be politicized, and independence. And if you look at North Korea and health aid and humanitarian aid, it's like it gets a fail, right? And not just from the international external actors, but also I will have to say DPRK has also politicized the receiving of aid. So it's a mess. Can we set new ground rules post-pandemic, respecting some of these aspirational values? I don't think we'll get them perfect. But can we at least say, if we're going to start re-engaging, let's try to put some guardrails around it so that we don't, we all sides agree not to politicize the assistance. And this is for the humanity. It stays going. The program continues no matter what. I mentioned a little bit before that the pharmaceutical imports had increased almost tenfold. If you also look at what they're importing, besides pharmaceuticals, they're also importing heavy medical equipment. They've imported an MRI machine, 2 CT scanners. And more interestingly, according to our calculations, it looks like they imported 150 ventilators, invasive ventilators. So if you look at the number of ICU beds in the Pyongyang, this exceeds that number. I think this is an attempt by the North Koreans to really strengthen their health system, investing in structure, infrastructure and equipment. And this is enough to equip really the major provincial hospitals outside of Pyongyang. So we think there is still an opportunity to engage in health. But if we're going to do that, I would recommend a comprehensive approach, because the North Koreans are not interested in strengthening their health systems. I would not try to do something that's a targeted intervention on a disease or a sector, but let's go ahead and help them strengthen the entire health system. I would also put on the table technology transfer. You know, look what happened with the pandemic. The African countries are now saying we're going to develop our own vaccines and manufacture them. The rich countries have failed us, and we don't want to be in the same situation again. North Korea is exactly the same way. They want to develop their own vaccines, and we should let them. And then humanitarian assistance will be a small part of the overall health assistance package, but it should be all bundled together. And it should be managed through a fund that's not politicized. So how do you do that? There are different mechanisms of doing that. A trust fund would be a good way to do it, where donors are putting.
Seems like there are some technical difficulties on part of Dr. Park. Let's move on to Margareta Wahlström, and then we can return to his final points afterwards.
Yes, thank you, Frida. I was very interested in Key's recommendations, but I can feel where he's going. So as soon as you reconnected, we'd like to hear the rest of it. So, so thank you for organizing this and putting us online to force our thinking a bit about the future. And thank you, Faye, for sort of the wider background that you have offered, particularly around this very important relations with China and Russia and the differing character of that. So just to give a bit of perspective on the humanitarian perspective, which first of all, I'd like to echo really what Key said. And this is so clear because we do have lots of meetings, consultations, but the reality is we don't know very much now about, we know much more about the security and weapons evolution because it's so in your face. But we don't know very much in spite of having continued working relationships with our partners in North Korea. We don't really know how people are faring. So whatever I will say, and I will be quite brief, will be an extrapolation of 30, 40 years of cooperation with North Korea in periods where things have been improving and periods where people's health and welfare has been undermined regularly by disasters or droughts, floods, typhoons, because the baseline, it's a very, very poor country materially, and people's stable health is actually quite fragile. So it doesn't take much to get an imbalance in terms of nutrition, infectious diseases, etc. I don't know, Key probably didn't say it explicitly, but once upon a time, North Korea had a good health system, a public health system. The infrastructure is good, but it's, of course, it's been emptied of medical supplies and medicines and important issues over the decades. And so the humanitarian assistance, as you're all aware of, in the mid-90s catastrophe, a mix of economic very rapid decline over a long period and a big disaster, the North Koreans actually asked both the Red Cross and the UN for humanitarian assistance. And after that, there have been, which I think contributed importantly to building up people's resilience again and health and get a stable basis. But there have been several periods of ups and downs on this restoration. But the focus of the Red, after the year 2000, there has not really been any food distributions of a classical kind. There's been a much more focus on specifically exposed groups, like children, women, pregnant women, elderly people, and people in hospitals, in order to ensure that I would say the limited and declining availability of humanitarian assistance was optimally used for the purpose of being a humanitarian gesture, just as also in an arena of very high politicization of many things, as Key also pointed out. So over the years, that has been it. It's been clean water in rural areas. It's been support to clinics and hospitals, particularly nutritional center for children and nutritional supplements. And also some efforts through many of the organizations to actually strengthen the health system. And of course, in the Red Cross, there has been a continuous support on the disaster management, building national capacity. And as you know, the country has also worked very hard on improving its disaster management capability, early warning systems. But as we can see, almost each time there is a major typhoon or flooding, bridges are falling down, houses are collapsing. Fortunately, not many people dying anymore because of evacuations, but a lot of assets people are losing each time. So in some of the humanitarian actors really try to stay as long as possible once the lockdown happened. But with lockdown, they could not work, and the banking system, eventually, they did not receive any money. So I think the final people who left, they left for very practical reasons, that they really could not accomplish much work. I will make a pause there so we can hear your final recommendation, Key. It was very interesting. Is that okay, Frida? I will just pick up after that so that I know.
Yeah, sure. That sounds great.
Oh, my apologies. I don't know what happened, but computer just internet. I lost internet. Oh no. So I think I got cut off when I said multi-year, multi-donor, a trust fund mechanism to avoid politicization, and it should be multi-year. That way, there's sustained programming. There's no stop and go. And as I mentioned, an agreed framework, at least for health cooperation, is needed. Over to you.
Good, thank you. And I have referred several times to what you said also, so I think we're talking very much about the same domain. So then 3 years where most of the actors in the UN, but also the Red Cross, we've kept staff in Korea, of course, and they have been working on as long as the resources were available, but eventually with an inability to transfer fund and declining contributions of funding, that has not been very possible to continue. However, as Key pointed out, we can see that some of the consignments of vaccines, of vitamin A's, on BCG vaccines that UNICEF has procured, and they've been given sanctions exemptions, have been delivered to the country. And the Red Cross has also had some supply going to the country. And we are assuming and hoping that it's being well used, just as the importation that the country is having. So a strong focus on health issues and a strong focus on disaster management issues, and also including that to try to strengthen the resilience of the infrastructure of people, of course, but also the infrastructure. So over the 3 years, contacts have been maintained very importantly, and now, as you both have noted, we see signs that, well, there is an opening, but how quickly it will go, what will be the priorities of North Korea in the opening, who are the partners that they will, so to speak, invite first or welcome first, and for what purpose, I think that remains to be seen. Very likely, I would assume that the diplomatic relations that have been maintained all the time, the diplomatic community that are important for DPRK, will be important to invite quite soon. Also, business and tourism have been mentioned for economic reasons. I think there is a genuine reason to restart the economy also. And as we've heard from Kim in his speeches, the agricultural development is a very high priority for self-sustaining the country, but they do need international resources here. They need fertilizers, seem to be acutely missing, etc. And they are working on, I would say, it's a country that is not naturally very suitable for agriculture. It's been more a mining and industrial country, but there is a necessity to reach a better level of supplying their own people for food and not having to import everything. So in the return, North Korea, like many other countries in the world, is nothing peculiar about that, don't really want to be a recipient of humanitarian assistance. I mean, who wants to be that? But of course, and we've talked with them many times, their priorities is technology transfer, development cooperation, health system, agriculture, industry, education system, all the things that a country like that needs to develop its economy and its social life. So, but they, of course, they understand the nature of the sanctions and the complications of sanctions and the limitations. But it's not only North Korea and the sanctions, it's actually also, and here is where the politicization of aid comes into the picture. Many donors have a very strict interpretation of the assistance that can be given. There was a time that I remember, which is a long time ago, when quite a few donors, they were very flexible in using short-term funding, which is the nature of humanitarian assistance, but still for areas, sectors of work that are more developmental, long-term in nature than humanitarian assistance. So that's an area of flexibility that I think all of us have been trying also to expand on over the years. It's been more or less successful, and it's very different from different partners and different funding donors. So when now, and we can see interesting signs, of course, of possibilities opening up. We don't know how quickly it will go. I don't think it will be very quickly necessarily, and it will be step by step for sure for political reasons, but also for public health reasons, which is a question I'd like to pose to you, Ki, afterwards, is what can you expect from the perspective of the fear of COVID spread, if you compare to what happened in China when they suddenly decided they couldn't close down anymore? What will happen in DPRK? And what if we get another wave of pandemic now? So that's certainly something I understand, and I believe in a way I hope for the health of the people, that they are quite sort of thoughtful in opening the door. And assuming that we also as cooperation partners will be welcomed in, we cannot just go back in, as I think you said, Ki, and start from where we left off 3.5 years ago. There are so many changes in the external environment, but there are also changes internally. And new people probably in the jobs, rebuild relationships with partners. We can see that in the international organizations, there are fewer and fewer people who have ever been to North Korea that are now sitting on their jobs to maintain those relations. So that will be a period of getting to know each other again and building trust, hopefully. There will also be, of course, a reassessment of what are the needs, how are we going to prioritize, on the assumption that we are still talking humanitarian assistance, at least until we get moving into the area that Yuki intimated. What will it look like then. The country's priorities are quite clear: disaster management, agriculture improvements, clean water, particularly in rural areas, but I know they're also interested in urban water. And that discussion will probably require some replanning together. It will be allowed to take time. And you know what, of course we don't know, if we cannot say much about have people health declined over these years. But if you look at many other countries in the world and the impact of the COVID and the impact of the economic situation globally, increasing food prices, one unfortunately will have to assume that many people's health and welfare have declined over these years. And can we then, together with the North Korean colleagues and partners, actually focus on strengthening this part of the population and the welfare? So I think these are the main issues. All this happens in the larger context that Faye describes so well. And as Key also points out, health really is a necessity and a priority, and really has to be part of that opening up together with other areas. And as I said, the sanctions regime is strict. It's probably the strictest one there ever was. We cannot transform money into North Korea, which has both international and national decisions on making that impossible. The sanctions committee there is a long list of approvals that the sanctions committee has given, but it doesn't mean that the goods will go in for many reasons. I'm not going to go into the details. So I think they, within the limited means, they are trying to do what they can. So if indeed, plus I must say one final thing that will need to be reassessed for those organizations and diplomatic missions who have left their offices, maybe their belongings, documentation, vehicles. They actually need to do a new assessment of how to restart all this. What does it mean? Is the logistics, can you actually fly several times a week or daily to Beijing or other capitals? What about insurances? So it's going to be, it's not just flying in and starting again. It's going to be quite a complex process. And that process, of course, has to be done also together with our North Korean partners, depending on who we are. And only finally that I will say, given the huge humanitarian needs in the world today, rebuilding the funding support for DPRK is going to take some heavy lifting. And it will, as I think you Key also question the motivation for partner countries to engage. It's not neutral money. Humanitarian financing has been quite okay, but there has to be, and I think the motivation for rebuilding the relationships with North Korea need to be scrutinized quite well, and the motivation, and I think that's an important conversation to have. So thank you. That was my conclusion, and I already have a question to my partner Key there, so I don't know if Frida, that's okay.
Yeah, I just want to say thank you both for such insightful presentations, and it will be really interesting now to dig deeper into these issues that you have mentioned in the roundtable discussion. So please go ahead and begin with that question of yours.
So I think, Margareta, by the way, I really appreciated your comments. Your question was how, to what extent did North Korea experience the pandemic, the outbreak, and how does it prepare them in the future, or what may have changed? For sure, they had an outbreak, right? So their approach was low tech, but very blunt. but it works. And it worked in the past. It's probably going to be what they're going to resort to in the future when there's another pandemic, right? It's not if, we know it's going to happen again. And they will go into isolation again. There's no question. But they know it's not perfect. And they experienced this outbreak. They said 5 million cases of fever. And we know that you can get COVID without any fever. So the number is probably an underestimate. So if you say, add 30% to that, if that many people, then this was countrywide, were actually infected with the virus, and many of them probably were asymptomatic, as I said, that is enough to really to start thinking about a natural herd immunity. Okay, so and I wonder if the North Korean population, only way to know, Margareta, is just to sample patients' blood, people, and then see who holds the antibodies. So and there was a study done in Malawi, and then Malawi also had very little COVID deaths reported. But then when they looked at the blood bank, a majority of the population had been already infected. And they didn't really see that huge surge in cases. So it's not out of the question that North Korea has something similar. I think it's entirely possible that they reached natural herd immunity rather than through vaccines. And that may be the reason why they aren't really, I have not heard there's any nationwide vaccination programs. There have been people who've been vaccinated, but I have not heard, not that it didn't happen, but have not heard that there was a nationwide vaccination program. They certainly can do it. They have access to the vaccines, but I don't think they did it. But yeah, so I think also that the outbreak that they had, it all alerted to them their lack of treatment capacity. So this is why they, I think, are strengthening their health systems for case management and purchasing these ventilators. So yeah, this is sort of my take on experience.
But you don't think, just as a follow, you don't think that in itself is going to be an obstacle to them opening up once they have decided? If there is a small outbreak in Pyongyang or something like that, no, they are beyond that.
So from what I can gather, and Faye, maybe you can chime in, groups have been going in with very little or no quarantine. Yeah. Right. I think the Chinese groups and the Russian groups. So that, and then I hear stories. I think maybe the similar sources like you, Margareta, where they're talking about very short time quarantines, like days.
1 week, yeah.
Yeah. But they'll be monitoring the overall global numbers, right? We're getting a bump now in the US, but globally, the pandemic, if you travel now, it seems like it's over. People aren't behaving like there's a pandemic.
It's not calling pandemic anymore.
That's right. It's been downgraded. That's right. Yes. WHO. Yeah.
I don't know, Faye, did you want to come in? Or I think Key forwarded a question to you there.
Yeah, I think there's maybe 0 to very few days quarantine there. And I think also judging from, the frequent meetings between Russia and North Korea now, the travel between each other, I don't think in practical terms, I would not assume the Russians go to North Korea and they're going to take days off quarantine and then to have the meeting. And apparently their foreign minister going to go again, actually just in 2 days to North Korea. And we will see what they're going to discuss there. But I actually have a question to both Kia and Margareta. But I'm very interested in the humanitarian system part, but I have very limited knowledge on this. And I was very interested that your point regarding, we should not politicalize, this kind of humanitarian assistance. But I just wonder how practical it is to make this kind of compartmentalization, not only from the international community, but also from the North Korean side, they may say this together, and I like Margareta mentioned, they don't want to be seen as a recipient, you know, like we receive the aid and so put them in a weak point, right? Or they don't want to be seen, don't want to link this kind of assistance as kind of reward for whatever their better behavior for, you know, like not doing MISA tests or whatever related to like security things. So I just want to throw out these questions to you guys and see what your reflections on this is.
You want to go first, Margareta, or you want me to go first?
You go first, please.
Yeah, great question, Faye. Yeah, listen, there's USAID sits under the US State Department for a reason, right? and most ODA type, you know, organizations sit under foreign ministries, and it's rampant. And I get it. It's you know, let's give carrots or sticks, and this is type of a carrot. So the question is, it's difficult. I agree with you, but it's worth trying, because there are, you know, we have agreed upon international, you know, resolutions, and people agree that this is a right thing to do. And if they are aspirational, no one could do it perfectly. I think probably the Scandinavians are one of the best ones to do this, do it well. It's truly they do it, they practice it better than anyone else, I think, because the assistance comes no matter what, because it's based on need and it's not politicized. So I think it's worth a try. We might not get to where we want to get to, but why not sit down in a neutral platform and saying, this is for the people. This is not about, you know, military issues. And they want to improve the health of their people. And I would not also frame it only for humanitarian assistance, but really health cooperation is the better language. And it's the bigger package anyway. And the humanitarian component could fit in there. But health cooperation, multi-year, can we agree that if North Korea does another atomic test, that there's no repercussions from in this corridor, right? There might be military and other political actions that are taken, but at least in health cooperation, whatever we decide to do together is not interfered by some key actors like, you know, US, let's say. At the same token, if the US increases their hostile policies, right, which is something that North Korea is very concerned about, North Korea doesn't stop travel of humanitarian workers. You know, they don't make it difficult. And I think there's, you know, no one's really tried it. And I say, let's try it. Yeah, we may fail, but at least we failed trying. Yeah,
exactly. I would agree completely with that. I think there is significant room for new ideas also in this arena. But also to say on the politicization, the so-called development cooperation is actually a political instrument today more than anything. And there is a tendency with the political developments in the entire world that it's not the most needy countries that get the best cooperation. It's the ones that offer the greatest room for success for the donor. So it's extremely instrumentalized and maybe a bit cynical. And it doesn't, in an awkward way, it doesn't then address the genuine, common, including security interest, which is stability. And I would say that also regarding DPRK and the Health Cooperation Initiative, because that's not just about DPRK, it's prime. They have a huge interest in it, but any health issue is a global issue because borders are actually not keeping these things out, and it's spreading like crazy. You know, with this slight so-called monkeypox outbreak, which wasn't, I don't know if it was even an outbreak in your terms, but it increased also anxiety in North Korea, and they started asking for, you know, vaccines, etc. So there's a very high degree of awareness in that. So I would say the humanitarian assistance, of course, should never be the main assistance. By its nature, even though that's not true since many decades now, it should be temporary. It should support the population during a period of time. But unfortunately, for many reasons, it's too much to go into here. It's become a long-term major instrument to sustain very populations that are very, very exposed and vulnerable in very unstable situations. Look at Democratic Republic of Congo, look at Sudan, Somalia. So it's become a different tool than it used to be, but the name of it is still one of but in terms of your question, rewarding for good behavior, I think there's much less in the humanitarian assistance than in the development assistance. The development cooperation would really be a reward for good behavior, and therefore maybe an instrument like the health cooperation and the trust fund, actually something that can be negotiated around. It can be a give and take around it, and the humanitarian side would be given it generously without too many preconditions. But given the way you described it, there will be both sides agreeing on the basic principles. So I would say, and on my motivation, from my humanitarian perspective, always over the many years that I have the opportunity to cooperate with North Korea, there's always also been this sense of that the humanitarian assistance is keeping the bridge open. When relations are not working and people are speaking to deaf ears on both sides, or all sides, I should say, the humanitarian assistance actually is well-meaning enough to somehow go through that, and the importance of it, I think, is still there. The Nordics, yes, we've been traditionally good at this. I'm not so sure we are so perfect anymore, but there's definitely a strong still support and understanding that humanitarian assistance is required. And as far as Sweden is concerned, diplomatically also, and the Swedish policy on maintaining the diplomatic status there, and the engagement is I think not touched anymore. Oh, more questions?
I have a follow-on comment, if I may. This is a roundtable discussion. So we're having a conversation. I just need some coffee.
Yeah.
So you bring up a really interesting point, Margareta. There's the value of the actual delivery of care, right? Aid and let's say even health. But there's that human element. When someone helps another person, there's this bond that forms, right? Trust. And within North Korea, one of the biggest problems for diplomatic breakthroughs is the lack of trust. And if we wanted to, and this should never be the intent of humanitarian assistance or health cooperation, but there is a trust dividend that comes with it. And we have a situation right now with the North Koreans having just released, very quietly, the private Travis King through the Swedish embassy with your assistance. So U.S. sort of got what they wanted without any kind of, problems. This opens the door for some kind of reciprocal action, maybe even plus alpha. I mean, I'm just saying there's, these kinds of actions, we should not just let it go by. There could be tremendous opportunities.
Yeah, absolutely. I think the Travis King is a very good example and could open another door, for further engagement. And it's also very interesting that, at least from the news, I didn't see any, negotiations, been taken between U.S. and North Korea, and they just released, Travis King. So that was actually very interesting development. And But also I see we have 2 questions in the Q&A box now. And to think about the first question, but for the second question, for the overseas workers, maybe I can take it. So I think I did a little bit of research on overseas workers, also because there was a discussion in their practice in Poland, Russia, and China. I think in general they live together in a very supervised space, a camp almost you can call it. So where they can go is actually they have very limited access to the outside the whole country, like where they posted there. So I wonder how much they actually experienced when they stay during overseas. And also I think this practice has been a long time, with North Korean workers work in Dandong, the border area in China. And I don't see they look concerned about, whether they're gonna bring back the Chinese culture, they see what developed in China and they're gonna affect the region stability. But now, so my short answer is that I don't think there will be significant impact on this stability unless. Otherwise, they will not send out them to overseas anyway from the beginning.
Yeah, thank you so much for that answer. Does Margareta want to add something onto that on the return of overseas North Koreans?
The only thing, because of the sanctions, they started returning, the sanctions then applied to overseas labor, and the countries that were having overseas labor were told to send them back to DPRK. So for me, from the perspective of the needs of people, there would be a potential economic impact of not very positive nature in terms of joblessness and people's reinsertion into society if there are massive returns. Now it seems that the returning has not been that very massive because people have met continued workers in Russia and Eastern Russia, etc. But the other thing I just read, which was a forced repatriation of people who were trying to flee the country. And on the assumption that they have not forced, of course, that is in itself a very negative sign. But if they've held back on forced returns over the past years because of the pandemic, it's just an indication of yet another hole in the border fence, so to say, that they are being sent back. So I think there is an economic, as in any country in the world, there is an economic and social impact of migrant workers returning home. That's for sure. Are there more questions from?
Yes. So we have a few more questions from the audience.
Okay.
Here we have one that says, how do you think a second outbreak of COVID-19 in North Korea would affect the country's cooperation with Russia?
Yeah, I think that the question and the second one after that is somewhat related. I mean, if there's an outbreak, that might sort of stall some of the exchanges, but in terms of actual cooperation, strategic cooperation, I think is going to continue. Listen, there's some discussion, at least among some of my colleagues here in the US, that North Korea has lost interest in pursuing any more, diplomatic normalization with US, and they've just lost interest. So now they're putting all their attention towards Russia and China, and now militarily with Russia. This puts US in a very awkward situation. It's going to increase the cost of negotiations moving forward. They're going to have to put something big on the table. The sanctions were passed. All the Security Council agreed, right? So the China and Russia voted in favor of the sanctions that sort of came in 2016, 2017. now you've got two countries from the P5 who are openly flouting the sanctions. I think it's an open secret. And then one of them has entered into a military cooperation, which was exactly what was the objective of the sanctions. And I just want to hear from Margareta and Faye, what does this mean? The sanctions do we need to reevaluate? And yeah, I agree, right?
At least you and I need to do it.
Maybe I can go first then. I think first of all, maybe just relate to the Q&A here. First of all, I agree that I think the cooperation will continue. And in terms of if even if a second outbreak of COVID happened in North Korea, they may learn lessons from the first one and try to manage it better and try to won't affect whatever they need to provide for Russia to exchange to their need. In terms of the end of Ukraine war, I think both Russia and North Korea understand that they are taking opportunity now for short-term gain for both sides, right? Just as I mentioned, like North Korea taking the opportunity for providing munitions to trade for food and oil, gas, and many military technologies. And Russia is also utilize this, for the first time, maybe North Korea also, North Korea's role also can be played as a card to leverage against the war against the West. So they both know that there's a kind of like short-term high-peak cooperation here, but also in the long term, I think even after the war, Russia, the sanctions of Russia, or like this long-term competition and polarization structure will remain. And in that sense, there still some way that Russia and DPRK may need each other to cooperate. So there is some sustainability in terms of the military side that they could work together. But in economic side, I would say we will still in the long run still relies more is trade with China. And in terms of sanction regime, I think this open violation, this high profile open violation by sending like the drone gift to Kim is very rare case, very rare case we see. Usually we know that happening, but they don't really report it with like a news saying, branding like, hey, here's the weapons, right? And of course it drives concerns whether this is gonna continue, what does it means for Russia's support for UN Security Council resolution in general then. But I don't think it's actually in the best interest of Russia for doing this kind of open violation. I mean, there are already voices regarding, China and Russia's veto power at the UN Security Council and whether there should launch a kind of reform related to this, right? So it may not be wise for Russia to continue have an open violation and like kind of disrespect the Security Council in the way. And I think it is actually in the interest of China and Russia to keep their veto power in this sense, right, at the Security Council. So I would hopefully that this kind of high-profile open violation will not continue. But under the scene, I think the violation of sanctions has continued for years, and we've seen that, right, between China and North Korea, between Russia and North Korea, and also sometimes like some South Korean people who has relatives or, they also kind of gray area, like support North Korea in a way, maybe not I'm saying from the weapon systems, but like food and other things, right? So this is like a long-term discussion already in terms of the effectiveness of sanction. And I think we have probably imposed most of the things that we can on North Korea after the 2017 sanctions. And there's really limited areas left that so we can impose more on North Korea. And it's clearly not really working well in terms of leveraging North Korea, to denuclearization or to restrain their provocative behavior. So I'm pessimistic in terms of the implementation of that, unless everyone will get on board.
I have a follow-up question on that. So during Kim Jong-un's visit to Russia in mid-September, following his meeting with President Putin, the Belarusian president also expressed that he would like to pursue closer cooperation with Russia and North Korea. And a Russian spokesperson also said that he thought it would be a good idea for Russia and China and North Korea to pursue cooperation. But then during your presentation, you said that China isn't too keen on being put together in this box with these two countries. But I was wondering what your opinions are on if these kind of revisionist agendas, if you will, if they will have, if they will open up for other countries to start cooperating with North Korea also. If a P5 member can do it, then maybe other countries will think they can do it too.
That's a very hard question. I didn't really quite follow the Belarus side.
So basically, the Belarusian president said that he would be interested in joining North Korea and Russia in their future security cooperation. So maybe other countries with similar positions could want to join as well. If you have any thoughts on the feasibility or probability of that happening?
I think this may just raise general concerns, like those countries like bonded together and further lead to a polarization of the world and what the US has described as a bloc alliance. And it definitely not contribute to the further stability of the either regional or global security in that sense. And hopefully that that's not really going to be materialized. And I noticed that Russians had actually proposed to have bilateral and even trilateral military exercise between China, Russia, and DPRK. And many have concerns that that may happen, start with maybe a low-profile naval exercise. And if that happens, this actually will be the first time DPRK join any military drills with any foreign countries since 1950s, I think. So that would be very symbolic and significant implications. But I have a general doubt that could actually, I have a doubt that may happen, especially, China has been trying to distance from its to have a link with military corporations with North Korea. So it's very interesting. This is Belarus' stance was talking about security cooperation with North Korea. But I haven't seen signs from other countries for showing to be part of it.
And maybe we can link what you just said now, Faye, to the sanctions regime and its ability to monitor violations, which is actually quite good, but they don't have any instrument to, except for name and shame countries that violate. So there are other countries that have some exchanges with North Korea, of course, that are forbidden by the sanctions regime. They are not of the scale that we are now seeing. But so it's there. But I'll go back to Keith's question or hope about the sanctions. Because for the longest time, and this one of the diplomats of the Security Council told me, the council was so unified on the DPRK sanctions. This is not the case necessarily with many other sanctions regime. There's always some country, either among the P5s or the other members, that are not really convinced or happy or whatever. But on the DPRK sanctions, it was for the longest time very united, until a few years ago, when 2 or 3 years ago, I think, when for the first time China and Russia together tried to propose more generous exclusion of the humanitarian assistance. which was a bit of a surprise because until that time also, at least in my dialogue with the North Koreans, they didn't seem to care very much about the sanctions as far as the humanitarian assistance was concerned, but then they did. So, and because of that, but also other very difficult discussions in the Security Council, the UN General Assembly took a new decision that if the Security Council could not come to a united decision on serious issues within their domain, the countries, and particularly the ones that they have the right to a negative statement, namely the P5, they would have to go to the General Assembly and explain themselves to the entire assembly. So good name and shame instrument, and it has of course happened, I think, once already. So I'm saying this, that in a way the Security Council is a bit undermined in its power by this, and maybe not just a bit, significantly. Nevertheless, there isn't any other instrument, and we can see that what is happening in many countries in the world right now, the UN as member states, not as an assistance machinery, they don't really have any political cohesion or instrument to deal with what's going on in the Sahel region, Ukraine, etc. So maybe, you know, I think there is always space for the humanitarians to be very critical of the impact of the sanctions regime. But one thing that I think key that we really would need to work on more is to demonstrate what's the impact on people's health and welfare of sanctions. And we've tried to do that through some case studies that the Swedish Red Cross initiated, and really start taking a hard look at it. And that will be an instrument that we can definitely, looking at statistics, data, we need good baselines. And maybe that is something ahead of us, because I think I don't hear anyone being willing to negotiate anything on the. I haven't heard the US being willing to give anything. I know they are saying they are always open for conversations, but clearly the North Koreans know what these conversations are about. So right now, you know, I think we are all wondering and looking for where is the little opening going to happen. Do the North Koreans not care about the US anymore? That would surprise me. But for the time being, I think they obviously put them aside. Because, you know, I think the neighbors, China and Russia, are very different. And at least for China's traditional position on the nuclearization of DPRK and how it's handled, let's say that China probably has bigger ambitions of the world than their own little corner in Northeast Asia, if I can put it like that. It's not so little in security terms, but in terms of growth, influence, and ability to maintain the leadership, co-leadership of the world evolution, I think China for sure, I would expect, will try to keep a good balance, even though for the time being that trilateral cooperation looks like something important to them. And I think we should continue to, I was going to say, stretch the sanctions exemptions and the regime in favor of the Korean people's basic needs. That's what I think the humanitarians can do. That's my final word for today, I think. Frida, is that time up?
So we have 5 more minutes, and I have
Okay.
one more question that I would be really curious to hear your perspectives on. So in Faye's presentation, she mentioned the possibility of people-to-people interactions. And of course, we've had these kind of international sports events where North Korean athletes have participated alongside other nations' participants. And I was wondering how, or if you have any thoughts on how the international community could pursue meaningful people-to-people interactions in these kind of international spaces, ranging from sport to maybe entertainment, et cetera, et cetera.
Yeah, I guess first of all, we need to make sure everything is under, the sanction regime is approved with all the activities. But just thinking about like, culture exchanges, right? So they still have several diplomats, embassies from North Korea in Europe, and that if any kind of culture exchanges activities, just for people to getting to know the country, that's also a big good thing. And also I'm talking about people-to-people exchanges. I know that maybe ISDP, correcting me if I'm wrong, has hosted North Korean visiting scholars before, right? So that's kind of like scholar exchange. I think is also good for North Koreans to get to understand more about how the international system works, And so I think that's kind of communication. And as Margareta mentioned, the human factor, so, and also Kim mentioned about building trust, that's also a very important part of this kind of exchanges. And of course, the sports activities, right? It's a very rare chance that you see a lot of North Koreans being out from the country and participating in competitions. And I think that's a very baby step, but very important.
Frida, can I ask another follow-up questions on the
Yeah,
future?
of course. Go ahead.
To Key, but also maybe to Faye. It's regarding the South Korea position, which right now is, I would say, quite hardening and quite aggressive. What would it take to change it? Sort of, both from the North side, I know they are saying no to South Korean financing, and Japanese as well. But what would it take to actually get the two countries to agree to each other again on the assistance and technical cooperation side?
No, it's a great question. So you are right. The Yoon administration is very hawkish. The Ministry of Unification has been reduced in size and power and purpose. They're now their job is to sort of find people who are violating the national laws for humanitarian assistance instead of facilitating. Well, if there's obviously a change to a more progressive government, it could change everything. But short of that, that the alliance is an interesting mechanism, right? The U.S., China, U.S. are okay, and now Japan. I don't see the South Koreans sort of being innovative or initiating much, but if the U.S. takes a leadership position, I think it wouldn't be too hard for them to convince ROK to come along.
Mm-hmm.
Yeah.
Okay, thank you so much. I'm afraid time is running out for today, but I can see that we could continue this discussion for hours and hours. And we have really seen some important issues being brought up in this discussion, such as the reframing of how to perhaps move from humanitarian assistance to more health cooperation in terms of working with North Korea in the health space. And this could really be discussed again in depth in another webinar. But thank you once again to our panelists. Great insightful presentations and discussions. I'm very pleased to have heard your perspectives. And thank you to our audience also joining us online and your very good questions. I hope this discussion has provided you with some new perspectives and sparked some new ideas, because it certainly has for me. So thank you once more, and have a great rest of your day, everyone.
Thank
Thank you,
you.
Frida.
Thank
Bye,
you.
Faye.
Bye-bye.
Bye, Margareta.
Bye-bye.
Bye-bye.
Yeah.